This is the first large-scale study to evaluate the relationship between BMI and age at renal replacement therapy, RRT, in these two ADPKD populations. People in the US have the highest, while people in Japan have the lowest mean BMI among high-income and industrialized countries. The results of this study suggest that the lower BMI in Japan is likely associated with slower progression of ADPKD, and that the different dietary habits in Japanese and American populations may significantly affect the progression and long-term outcome of this disease.
This content is copyrighted by Mayo Foundation for Medical Education and Research.